This hurricane was different. This hurricane was our first activation since Ian, so there were a lot of feelings. Ian brought emotions. Ian touched a lot of lives. Ian touched every life. And so people were scared. People were worried about their families. They were worried about coming in and what it would entail. The system did a great job. They recognized it firsthand. They had lift rides ready to go for people. People were planning carpools. People were ready.
Our team has been absolutely amazing. They came in here to make sure that our patients and each other and the whole hospital is safe, and they've done such an amazing job. Very upbeat, great spirits.
Hi, welcome to Hospital G. Team Medical.
They're here, they come in because they love what they do. Every single person in this building loves taking care of their patients. They, in NICU specifically, they love the babies, they love the families, they love each other. And so they're here to take care of those patients. And they know it's going to be okay. Together we're going to rally and we're going to navigate anything that comes our way.
As you roll into that, what is typically day 2 of team activation, you're heading into your active storm. And so there's a lot of activity that goes on there. We're getting frequent updates about the storm. We're getting calls into command center for, some of our facilities issues or things that are popping up throughout the day. We are attached to Health Park, so we're 2 sister hospitals that operate separate command centers, but we share a lot of services, and so we have to work together.
So far, the building is still fully up and running on our traditional municipality supplies of water and for power. We'll continue to monitor that throughout the day, and we'll transfer to generator as soon as we feel we need to do so to prevent the power bumps from happening.
Stress relief is key. People have to have a safe place. People have to have that person that they can go to and just say, I'm scared. We've built a lot of that into our units. We've built a lot of it into Golisano and Lee Health as a whole. The dogs are huge. They're a game changer. They come up and people just go to them, and the dogs will basically hug you. You hug the dogs and your world becomes a little bit better.
When we're able to, we love taking the dogs, Lemon or Dorian, to go visit staff and kind of give them that morale boost, some of that positive, fun stuff that we get to do at the hospital, just to really, encourage them, tell them that they're doing great, give them some of that positive boost that can sometimes make a difference in their day. And, I heard a lot of them recounting, this is the best part of the whole hurricane.
This just made my day.
He's the first person everybody recognizes. He's the first person dog, I guess. Everybody recognizes, says hi to. It's almost like you become an afterthought, but not in a bad way, because you know what these dogs bring. And then you have the hurricane and you're adding on top being in a hospital. You're away from your family, you're away from your own pets, you're away from that security, that comfort of your home, and you're not sure what you're going home to. Thank you, buddy. I think it's really important to have them be a part of Team A and help even normalize things for staff who may be missing their own family and pets and worried about them.
Watching the storm the last 36 hours, there were so many ups and downs. 1 minute we felt like we were in good shape, the next report we weren't. This time many of us got very lucky. There's still damage in our area. People still are going to face flooded homes again, but minimal compared to what we went through with Ian and what those north of us are going through. I think we are blessed as a team here. And what I do know is that we are a family that will take care of each other regardless of what we need.